Well, new for you tonight at 11, we are digging deeper into a miscount of medical marijuana patients in Georgia. Today, the state's Department of Public Health revealed it's miscounted the number of patients and caregivers for years. Health officials previously said the state had about 50,000 people signed up for its low THC oil registry, but now they say the number is actually only 14,000. 11 Alive's Dawn White joining us live in the studio with how officials say this happened here, Dawn.
Jennifer, the state health department noticed inconsistencies within the registry, and then they realized the system included expired and duplicate cards, patients counted as caregivers, and more than 3,000 patients who had died. This is 6-year-old Emma Gray's job before taking her medical cannabis medication, and this picture is just minutes after.
She started having infantile spasms at 6 months old, and then she was seizure-free until she got COVID 2 years ago, and since then she's had constant seizures daily.
Angela Yop says her daughter was born with a rare seizure disorder, which progressively got worse.
Her last EEG showed that she was having seizures every millisecond. Even though we can't see them, it spikes in her brain.
Now, the Georgia Department of Health reports the state has only 13,000 registered patients like Emma Rose instead of 30,000, and only 1,200 registered caregivers who can pick up medication instead of 21,000.
I think that's ridiculous. I think they need to do a better job at doing their job.
The health commissioner says the state relied on doctors to remove patients who stopped using low THC oil or died, but many of them stopped reporting that information during the COVID-19 pandemic. The department will now verify patient information twice a year and train doctors on reporting the status of patients. According to previous 11 Alive reporting, the number of registered patients directly impacts the number of dispensaries that can open. I reached out to the state to see how this will affect patients, manufacturers, and dispensaries, but I haven't gotten a reply. I also reached out to the state's 2 licensed medical marijuana companies, and less than 2 hours ago, I heard back from one of them. The CEO of Botanical Sciences says they're disappointed to learn about this discrepancy because they rely on the state's numbers to make business decisions.